Good morning or good afternoon, everyone. I'd like to welcome you today to today's policy briefing from Surviving to Thriving, hosted by the Compact for Thriving Communities. I'm Deb DeSantis. I'm President and CEO of CSH, Corporation for Supportive Housing. The Compact for Thriving Communities is a coalition of national nonprofit organizations that are working collaboratively in part with members of Congress and federal agencies to support health, choice, and equity for individuals who find themselves caught up in public systems. This coalition is working on behalf of more than 1 million individuals and families marginalized by the intersection of poverty, ageism, disability, and health status, racism, and discrimination, who find themselves in and out of various institutions, largely due to the lack of affordable housing without access to the important supports they need and want in the communities they choose. One of the most pressing equity issues of our times is hidden out of sight in shelters, nursing homes, psychiatric hospitals, group homes, prisons, and jails. What you will hear today is how the Compact for Thriving Communities is looking across systems, sectors, and silos to offer people more and better choices, support improved health, and advance equity, frequently at much lower public costs. Our goal today is to tell you more about this challenge and engage you in the opportunity to fundamentally transform the current approach, from siloed crisis intervention to more coordinated and efficient delivery of services that help everyone thrive in their communities. We welcome your partnership and ideas for how we can advance this work. So without further ado, I'd like to walk you through the rest of today's agenda. We'll start off with a national perspective on what we know about the need, presented by Gabe Schuster, Senior Program Manager for Strategy and External Affairs at CSH. Then we'll have an opportunity to hear from Zandre Johnson, a CSH Speak Up advocate, about her personal experience, followed by discussion with members of the Compact for Thriving Community Steering Committee, including Christine James Brown, President and CEO at the Child Welfare League of America, Deanna Hoskins, President and CEO at Just Leadership USA, and Linda Couch, Vice President of Housing Policy at Leading Age. We'll then close out with a brief overview of the Compact's policy principles and take any questions you might have. So let's begin by having Gabe Schuster give us a snapshot of what the data tells us about the magnitude and nature of the need across key systems. Gabe?
Thanks, Deb. So CSH estimates that in the United States, there are at least 1.1 million households with unmet needs for supportive housing. My goal in talking about the data related to unmet housing need across systems is to provide context for this conversation on thriving communities. In thinking about the scale of need for housing with services across the country, administrative data helps us identify the strategies necessary to meet that need, which align with the resources in a thriving community. Problems of inadequate housing exist across scale, and policy, in the sense, is an important strategy because it can efficiently provide scalable solutions. And when I reference scale, we can think about it in terms like these. So as an example, there's a homelessness crisis on Skid Row, a related crisis in Los Angeles behavioral health systems, a related crisis in California's justice system, and a related crisis in the United States. Thinking about scale lets us dissect what factors contribute to this crisis, where those factors are located, and therefore what levers are available to address them, be they federal, state, and so on. Using data to guide this work helps us stay focused and organized. In the case study shown here, we can track an individual who touches multiple systems over the course of a year. Someone who moves between the homeless system, healthcare settings, and carceral systems has unique needs, and any of those systems in isolation may not adequately identify the extent of their vulnerability. Focusing only on homeless system data can miss the total extent of need in our communities. At CSH, we've widened our focus in these conversations, stepping outside of the traditional homeless frame and thinking more broadly about other systems that come into contact with vulnerable populations who need housing and services. By focusing on thriving communities rather than systems in isolation, we can develop a model that more accurately captures a community's need for housing and services. So when we model unmet need, we think about the homeless system alongside the justice system, support systems for people with mental and behavioral health needs, systems serving people with intellectual and developmental disabilities, the aging, and those engaged with vulnerable youth and families. Within these systems, we have identified data that describes the total count of households that are housed by or held in those systems, and then apply quantitative research and qualitative data from stakeholders and advocates to estimate the rate of housing and services need within each subpopulation. This, combined with data on existing interventions, yields an estimate of total supportive housing need at the state and national level, our 1.1 million households with unmet needs. When we lay those systems together, a few interesting patterns emerge. It's not surprising that a few highly populous states account for the majority of the nation's total unmet need, as shown in the graphic at top. But when we look at each state's unmet need for supportive housing by its population, however, we see a very different trend. The rate of supportive housing need is relatively flat across the vast majority of states, and there's no indication that the local political landscape has a major effect on the extent of a state's unmet need. Users are also often surprised to see how a large share of the unmet need lies in our aging population and among individuals on waitlists for IDD services. Using data to reframe the conversation on unmet need for housing and services from the homeless system to a more expansive approach is a driving factor behind our integrated approach to thriving communities. When we think about the demographic makeup of people coming into contact with these systems, it also becomes clear that the issue of unmet supportive housing need is closely tied to racial and ethnic disparities in how these systems function and the outcomes they deliver for our communities. At CSH, we applied a racial disparities and disproportionality index methodology to the data about these systems in order to calculate a value for each racial and ethnic group that tells us the likelihood that they experience or come into contact with one of these systems compared to the likelihood of people from all other groups. In the data shown above, I've calculated national average indices for the different systems we assess. Across the country, Black families are 2.5 times more likely to experience a child removal through child welfare involvement than non-Black families, and are nearly 6 times more likely to be homeless than non-Black families. American Indian or Alaska Native individuals are 3.5 times more likely to be housed in mental health institutions than individuals from other groups, over 5 times more likely to be chronically homeless than other groups, and youth from that community are 4.3 times more likely to be homeless than non-American Indian or Alaska Native youth. Across homelessness, jails and prisons, child welfare, and behavioral health settings, white individuals and families are considerably less likely to experience systems involvement than their non-white peers. I'd encourage anyone who's interested to visit www.csh.org/data to look at the details for their state and to explore the tools that we've developed for assessing supportive housing need. Both our needs assessment and the racial disparity and disproportionality index provide breakdowns of data on a state-by-state basis. I also want to encourage everyone to think about how we use data to approach this question of unmet need as a process. We collect data so that we can better understand the current state of our systems. We use that understanding to drive change through policy, to achieve better and more equitable outcomes, and we close the circle by advocating for the collection, analysis, and publication of better data so that we can reinvest in the process. The need for broad housing and service-based interventions is greater than the need for supportive housing alone. We focused on supportive housing here because the targeted universalism paradigm instructs us that if we design systems to meet the needs of our most vulnerable community members, we will design systems that can serve the needs of all of our community members. Adopting a data perspective that focuses on all the aspects of a thriving community allows us to identify gaps and disparities that exist at multiple scales and across multiple systems. The need for supportive housing cuts across all states, independent of politics. There's a gap everywhere we look, and it's becoming increasingly clear that a siloed approach to data is not working. Adopting an integrated approach to data across systems is a key step towards building and growing thriving communities. Thank you so much for your time, and I'm going to pass it back off to Deb DeSantis, who will be talking with Zandre Johnson.
Great, thanks, Gabe. So now it's my pleasure to introduce you to Zandre Johnson. Great. Zandre is a CSH Speak Up advocate. Speak Up is a program that empowers formerly homeless individuals to use their personal stories as an advocacy tool in the fight to end homelessness. It's designed so that people who have experienced homelessness can help to inform and improve homeless systems and services, and through their stories communicate how housing ends homelessness. So welcome, Zandre.
Thank you.
Zandre, you're in housing, you're in supportive housing now.
Yes.
You have 4 wonderful children who are all grown and doing well for themselves. You
Yes.
recently took a job at the hospital. Congratulations, by the way, on your new job.
Thank you.
But your path has not been an easy one. You've spent time in prison, you've had involvement with child welfare, and you've experienced homelessness. So
Yes.
as you look back, can you share with us what would have helped you to avoid your experience with the different systems and institutions?
Yes. Let's start with welfare, Deb. Welfare with my children was, I was with their father who has passed on, and he had criminal activities. In the 80s, there was this big crack epidemic of selling drugs or whatever, and he was a part of that. But we were still raising our children, and my children came home every day at the same time. And this particular day they didn't come home, and they hadn't made me aware that they were going to stay after school. So an hour after they had not came home, I said, well, let me find out where these kids are at, because this is unusual for them. So I called the school to ask them, were my children on the playground, and the lady asked me to come to the school. So I'm thinking I'm going to pick up the children. She hands me a card from a social worker who had picked up my children from school, and I was totally unaware of it. So I still had enough time, because it's like 4:30, I still had enough time to call this woman by 5 o'clock. So I called, I got her on the phone, and she said that my children were in protective custody because of a situation, and they would send me a court date to go to Judge Edelman Court to find out what this was all about. So, frantically, for the life of me, I couldn't understand what was going on. Really, I couldn't. So anyway, we got the court date. I went to the court, and the judge asked me to leave the father in order to get my kids back, because he was in this situation where they couldn't catch him with drugs or whatever. So the feds had got involved, and this was a part of what they were doing. So they absolutely snatched my children from a school, and they were unaware of all of this stuff. And we had to go through this system for 2 weeks. And then my children was returned to me without totally no explanation. But what I kind of came up with, and what he came up with, and what we heard through the lawyers or whatever, it's like they just snatched my children. And because of that, I was not only more devastated, because I had been through a lot already, but now my children are going to be affected by these things that are happening to my life and their life. So all of our little piece of family was just torn apart. And it was a struggle with my mom and my children being their supportive system to maintain that my children don't end up back in the system. I might go back in the system because I got to afford them. And it was just ugly, completely. But if I had had some kind of pre-warning, like the social worker came and talked to me about this situation, and said, well, if you don't do this, that, or the other, we're going to go do this, that, and the other. But I had no pre-warning. It was just, it happened, and I still feel the devastation. My children have grown past that devastation, but there's times that we sit back and they remember that time. And one of my daughter is incarcerated right now. My middle daughter, she's like, she was one of the children that I couldn't shake from those feelings. And I'm still working on her right now today, very closely, because I don't want my daughter to repeat my history.
So what supports, Andre? So I know you had shared with me, if someone had, treated you with respect and explained to you the process and what you needed to do on behalf of yourself, that perhaps the result would have been different. But, aside from being treated like a human being, What other supports would have been helpful to you?
The community, like everything is based on community government, right? And social. So I strongly believe if that social worker had a communication with me, not only saved me, but saved my children. I knew my kid's father was involved in things, but kind of like you turn a blind eye because you're trying to survive. I don't want to be on the streets with my children. The father was there. So if someone from that system had to just talk to me and help me navigate even to out of that house, it would have been better for me and my children. But I never got any of those things. I just got the erupt, it happened, and I got the erupt, it finished, and then I got the recourse from my children growing with this feeling of why they came and took us, Mom.
But what changed for you and your families, Andre, when you were finally able to access supportive housing?
Oh my goodness, like life changed for us. They started I have 3 daughters and 1 son. They started believing that there were people that cared because they looked at my life had been so many different things. Deb, I've been in prison and all these different things. My mom passed away 2010. I was in a homeless shelter. All these things, they went through these events with me, with wives and children now, and so for them to feel balanced about life and not have that question mark about nobody ever helped my mom. They saw me in supportive housing as a blessing. Like somebody finally heard my mother, and if they could have helped my mom a long time ago, what could have been life for us? But life is good for us, so we're not going to ask that question. That's how my children felt.
Was it easier for you then to access services when you were in housing?
Yes, because again, I didn't even know these services existed until I went to PATH, People Assisting the Homeless. I had no clue that this help was even out there at any time of my life. Anytime that I was out there homeless, anytime that I was dealing with a bad relationship with my children's father, I never knew that there were services out there because there was nothing on a poster that said they would help me.
Right.
And so, I see the help on posters now, but I didn't see it then. So I thought I was on my own and against the world.
Zandre, I know you know this. You and I are getting older.
Yes.
What concerns you about getting older?
What concerns me about getting older is not so much as housing, because I'm in a senior affordable housing, right? But because I got married, they took my income down to $144. My wife's, her husband passed away, and he was in the service, so she was able to retain his income. But for me, they took my income to $144. So that gave us like $1,300 to live on for the rest of our lives. And we had developed, because I was on SSI, we got a car, we got insurance, we were going places with with our grandchildren. We were doing life. And all of that changed once I went to 144. So I had to go back to work, and in that working process, I did a ticket to work. The first time I worked, I did a ticket to work. And a year after that ticket to work, they forgot to do the reductions. So they penalized me for them not doing their paperwork. And so they reduced my income even more so before the 144. Because they say, oh, we didn't do this, and now we have to do it, and this is your income now. I had to accept it. But when they took it down to 144, I became afraid. I became very afraid because, like I said, we got a car. We've since got 2 babies, my cats. I've had this life. Me and my wife's name is Joni, with doing things with my grandchildren. Taking care of us. And with that happening, I saw myself maybe being hungry in order to afford the bills. Her being hungry, I saw myself losing the car because I couldn't afford the monthly payments or the insurance on it. So I went and I sought out a job, and with that job came a lot of stuff too, because it was a job that I applied for that had a background check.
Mhm.
And I absolutely had to write a letter at 63 from 20 years ago why I was incarcerated in order for these individuals to accept me for employment. And that had me on pins and needles because that wasn't who I was today. So I
I
was on
bet.
pins and needles. Mhm.
So I don't want to put words in your mouth, but you've said this to me. So, you know, I want folks on this call today to understand this, that what you shared with me was that over time you've felt like it's been one step forward and two steps back. Every
Oh,
time
absolutely.
you try to do something to advance yourself,
Yes.
there's another barrier to your
Yes.
benefits,
Yes.
and you get penalized in a way.
Yes. Because of housing, when you work, you
Mhm.
have to report all your income. I live in supportive housing, Deb. So because of that, I do yearly with supportive housing, and I also do yearly with Section 8. It's two
Mhm.
different entities, but the same entity, you know? And you can't make over a certain amount. It can't even be 1 cent over, or you could be penalized for it, you know? So I'm
Sure.
always under scrutiny. I've never been able to come in my apartment and just breathe like, I'm no worries. At
Mhm.
some point, I have to worry. Even getting the job, I worry, okay, now I got to report it to Section 8. So, you know, after 10 days, you have to report that income, or you could be penalized for it, or it's a criminal offense if it goes any further. And so I emailed my worker, you know, and told her this is, I work for LA County USC, and I clean pandemic rooms, COVID rooms,
Mhm.
you know, for patients who either died or have phased out into betterness. And I clean those rooms, and it's constant. It's never not work, but I'm proud to do it because they don't know I'm doing it, you
Thank you
know,
for
and
doing
I'm
that.
making good for them. And the thing is when I had to report, I got so freaking nervous, you know, because I feel like I'm up under this scrutiny to go forward. So that's what I mean by I have 10 steps, and I go 8 of them, and well, 10 of them to live in a thriving life, you know, to see a future. And then I go 2 steps back because I have to report all this stuff and be afraid that they're going to say, you make too much, or there's a problem, or the place I live in doesn't meet the match of Section 8. So
Right.
one of those or the other is going to go wrong for me. So yeah, I live in constant fear up under government policies. I do, but I strive, you know, and I hope for better, for not just me, for everyone.
Nice.
Hmm.
I want to quickly transition to our panelists, but before I do, Zandre, what does thrive mean to you?
Oh man, first of all, home means safe, you
Mm.
know, security, and I'm able to dream and go forward like I'm doing now. Like I'm working for the medical coroner's office right now. You know, I mean, I'm seeing things that I could just improve in, and whew, the government and our community and our counties stop penalizing us for being poor.
Mhm.
You know, it's sometimes people say it's race. It's that sometimes I look at it just the race is poor. Like
Mhm.
if you're poor, no matter what color you are, background, no matter what, you still go through the same thing as I would go through as an Afro-American, you
Yep.
know, and uh, I just want government to ease up on all these things that they write up for us to live by, like rules.
Right.
You know, if they take down some of those rules and let us dream big and have a life, so many of us would be so productive.
Great.
But
Well,
everybody's scared.
thank you for sharing that,
Mhm.
Zandre.
You're welcome.
Appreciate you spending time with us today, and I appreciate your efforts on behalf of the Compact for Thriving Communities.
Yeah.
So let me now invite our panelists to join the conversation. Great, welcome. All right, so I want to start out by asking you each to respond to what Zandre shared with us. So you heard Zandre talk about her involvement in multiple systems: justice, child welfare, homelessness, her thoughts and challenges around getting older. So how does Andre's experience align with what you see relative to your own work? And I'll start out with Christine.
Sure. Let me start first, though, by thanking Sandre for that remarkable story. I work for the Child Welfare League of America, so my job is to work with the organization to work with children and families where there is some type of abuse or neglect involved. And your story really reminds me of how much work we need to continue to do. So I'm so pleased to hear it. I want I want to say a couple of things. You know, the child welfare system was set up to address abuse. It is now addressing neglect have to do with neglect, not abuse, and another 15% neglect is a piece of it. And we are obviously not organized or funded or have the tools to address neglect, which has as its foundation poverty. And I think that as a country, we really need to understand the kind of impact that poverty has on families. The fact that you are in constant fear of how you're going to manage all the resources that you are receiving. So I think one of the things we've been thinking about and doing as a system is thinking about how to factor in poverty better and how to train people and help people understand the families that they're working with and how to address all of the needs that they have. There's a barrier, though, that all of us have to deal with, because if we're only funded to do primarily abuse, who really is going to do the poverty issues related to neglect? Who's going to help with the housing? Housing is a significant reason that people come into the child welfare system. And how can we break down the barriers that prevent us from understanding how the other systems are interacting with families and how we can share data without being worried about privacy issues, but yet share that data with respect for the families? I think there's a lot of work to be done. And in my view, if we flip it around from a child welfare system to the welfare of children and families, I think that will take us a lot further, because it's the community that should have been supporting, with child welfare invited in when it needed to be invited in. I mean, the school could have worked in a whole lot of different ways with the families, with Sandra and her family, rather than immediately calling in child welfare. It could have been handled differently, but the school had no options either, because there's no system of support for families. And we're looking now at the fact that a majority of the cases that we're seeing now call into child are coming from teachers. Why is that? Teachers are there seeing basically things related to poverty, not abuse, basically poverty. They have no place to report it, nothing to do, so they report it to child welfare. So as a society, we need to think bigger about what we need to be doing to support families before they fall into these systems that then take away their dignity and require that they do things that other families are not required to do. So I think we have a lot of work to do. And Deb, you know, we've been talking about it a lot, to start by listening to the families. What is it you want and need? How can we do things differently? And how we can do things so we can make sure our system doesn't have to exist in the way that it exists now. So I just want to go back and Sandra, your remarks were just so important as a challenge to all of our systems, not just child welfare, all of the systems that have failed families. And I agree, it's mostly poverty. Does racism come into play sometimes? Yes. But I think at the bottom of everything is a real disrespect in this country for people who just happen to be, because of life circumstances and other things, don't have the same access to resources.
Thank you, Chris. Deanna, your thoughts?
Thank you. And I'm saying with Chris, I want to start by thanking Zandria for sharing her story, sharing the story of millions. We heard Zandria's story today, but it's the story of millions, and it is very similar to my own story. Just Leadership USA is a national organization that was founded by and operated by formerly incarcerated individuals. We actually train, educate, empower, train formerly incarcerated individuals to utilize their voice and their stories to dismantle the oppressive systems. We focus on decarceration strategies, but what we realize, criminal justice is just a symptom of the overall problem that we're facing in this country, and I think Chris talked about it. When I think about Zandria's story, I had to take notes because she touched on so many things. And some of the highlights that I want to touch on, what she talked about was the trauma imposed on her and her children. Nobody came back to clean up that trauma. The fact that Black women get held hostage by the criminal justice, the child welfare system based on who we love. We aren't given an option and resources, as Chris talked about, talking to her before time to intervene. We get caught up in those systems. She talked about the impact of family separation. And one of the things in this country, we're facing an immigration problem, but Black people have been having family separation for years since slavery. And nobody has addressed it, and it hasn't become a big crisis. But the overall thing that really harped from her story for me is just the lack of human dignity and respect that we as individuals have to face. There was no protection from the consequences that were gonna come from that interaction, that engagement. There was no protection of, again, the children acting out in the trauma. So one of the things that I focus on, because again, Zandria, your story is so much like mine. After being arrested based on a drug problem that I had 22 years ago and getting a felony conviction, nobody prepared me for the housing situation. Right. Part of my sentence was to get custody of my children back, to regain custody of my children and to take care of my children. How? When now this felony conviction is being utilized as to where I could live, where I could work. As Zandria talked about, nobody has posters of the services. But I guess my problem is, why does the services have to come as a reaction to the problem versus as an intervention to anything happening, right? So you take a person who's formerly incarcerated, being released from prison, who's up under scrutiny to get a job from probation, to maintain custody of her children in a healthy, safe environment around housing, and society has created these barriers. So one of the questions I've been posing nationally, we've all heard of the term recidivism, right? Individuals going back. But recidivism, and this is just who I am being very deliberate, recidivism is based on an individual's failure. Nobody talks about the systemic failure to actually help me balance out what my needs are and the systemic collateral consequences that came from that. So when I hear her story, and even the fact that she's in supportive housing right now, and based on rules, I'm even limited. I'm still oppressed into how far I can dream, how far I can go, because if I tip over it 1 cent, I'm subject to lose my housing and be caught up in this spiral of homelessness again. So when we look at this, when are we gonna stop in the name of oppression or rules or regulations? Yes, supportive housing, but it still has an oppressive nature because it's hindering my ability to dream or actually further advance in my life, because that trauma of homelessness is still there. That trauma of that inability to take care of. So I wrote at the top of my paper, it is hard to be living in the United States and be poor, formerly incarcerated, and Black. And I'll close with that.
Deanna, I want to say how much I appreciated your last comment about, supportive housing potentially being oppressive. One thing I say is what we don't want to happen and what cannot happen is that supportive housing becomes the place that people get warehoused. That supportive housing becomes the place where people aren't treated with respect and aren't given the supports that they need to thrive, not just in housing, but in the community. So I think it's thank you for that. And I think it's important for all of us to keep honest about that and be introspective about that. So Linda, your thoughts?
Yeah, and thanks, Deb, and thanks, Chris and Diane, and I echo your heartfelt gratefulness to Zandre's testimony. What I really took from Zandre's responses and your words, Zandre, I took a lot from it, but I think what's really sticks with me is your I forget how old you said you were, 63 or 64, your fear, right? You were still feeling like you were living under this fear that all you have gained, how far you have gotten, how far your children have gotten, can be taken away from them, and how fragile that all is, and how that fear, to me is a result of a broken system, right? And how the inadequacy of federal safety net programs really shows itself in your story, right? The very haphazard, right? They put upon you, forced into your life without your knowledge, and how you were able to get to where you are today was really through a pretty haphazard and not planned by society set of interventions, right? Leading age, our members are aging services providers across the entire continuum of aging services. So we've got members who are in nursing homes, assisted living, life plan communities, hospice, home and community-based services providers, and of course, affordable senior housing providers. But what's true in this conversation for me is that as poor people age, their choices for how they age and where they age narrow to very few choices. And, we have really failed ourselves when we think about how hard we've worked as a world to live longer. We haven't thought half as hard enough about how we, as we do live longer, how well we live longer, and what supports are out there for us. So, there's a lot to unpack there, and poverty obviously is the common core, but racism is definitely a piece of all this, and the racist history of U.S. housing policy, U.S. Healthcare policy, can't go unchecked here. But I would say that there is, your story unfortunately paints a really vivid picture of a lack of cohesiveness of a federal housing safety net that is meant to help people rather than to say check a box or to spend as little money as possible. And that's where groups like CSH and others come in to level set the playing field.
I'm kind of curious to hear what you and your organizations have learned from the pandemic, and what it has caused you to either change or double down on in your advocacy efforts. Maybe we'll go in reverse. Linda?
Okay. Well, it's a great question. And I think, the first thing that comes to mind, what I've learned is that in a very fundamental way, the federal government does understand the connection between housing and health, right? It was the CDC who put out the eviction moratorium. That, I think, is, it's a framework busting move by the CDC to put in place a housing eviction moratorium. So that, I think, is that's a huge shift in the housing policy world, and thinking from an infectious disease agency. And then thinking back, it was in the early 70s, right, where housing vouchers were being started. They were started as a public health measure in large part because slum conditions were so bad. The federal government thought that vouchers with their housing quality standards would help raise housing quality across the country, and it was indeed effective. And so I think that, just for me, seeing the CDC take action on housing policy in such a strong way during the pandemic, I think is really bold, and something that we will only serve ourselves to glom onto and exploit that in every way possible, this connection between housing and health.
Deanna?
You know, one of the things COVID, and I don't think COVID brought it to my attention, but COVID launched me into it. We were advocating for conditions of confinement, torturous jails, but coming from the Department of Justice, coming from working in grassroots, I knew there was a connectiveness, right? So what COVID has really afforded us the opportunity to do is to really talk to the foundational need of cross-pollination, of cross-collaboration with other entities. So I'm grateful to CSH for actually reaching out to Just Leadership saying, hey, and I'm like, yes, we need to be. Housing is an issue for formerly incarcerated. But at the height of COVID, again, we put all advocacy work on halt, and we took all of our general funds and we focused it on the population. Because at the height of COVID, when jobs closed down, those were the jobs that first closed down that were more apt to hire people with criminal backgrounds. So they were the people who showed up at work the next day and their jobs were closed. You're talking about the restaurant industry. You're talking about social in the hospital, in the hotel industry. In construction came to a halt. Those were the jobs where people were living paycheck to paycheck. We knew that people were not going to be able to buy groceries. They weren't going to be able to get their medicine. And we converted and started reaching out to our funders saying, we need funds to give out gift cards so people can meet their basic human needs. And at the time I was in New York, so the governor definitely did the eviction moratorium, which was huge because we knew the landlords in New York are notorious for evictions, but also the process to evict in New York is much harder than it is in other states. It's easier in Ohio to get a 3-day notice, 10 days, end up in court, and by the end of the month, you're being evicted. That is not the case in New York. It is really a process because of the lack of affordable housing. So we really started paying attention to that, but we pivoted to individual needs because we knew people weren't going to simply be able to buy groceries, but we also then advanced as an organization to everything we do is in a cross-pollination way where we speak from the criminal justice aspect. We can no longer keep talking about these issues in silos. It's too distracting. We're more powerful together.
I love that. I think I'm going to get t-shirts made up, cross-pollination, cross-collaboration. It's perfect. Chris.
Yeah, I'm going to echo that. I think there are two things that were my takeaways for learning. One has to do with kind of the ahas that went off. One aha was around how interconnected we are. Child welfare tends to be very siloed in our views. And I saw agencies reaching out to schools and to community groups and really operating in a different way, trying to be much more integrated in how they address the wants of children and families. And connected to that was a better understanding of the devastating impact of poverty. So those two ahas, I think, are going to move us forward in some interesting ways that we can talk about later. I think the other thing, though, that's not been mentioned, and it happened for us, and I think it happened for our country too, is we decided that we could do certain things that we either weren't willing to do or just didn't do before. We could use virtual visits. We could do virtual court visits. We could do things differently that we never were willing to do. And I think that I hope that kind of spirit of we can do these things, we can work differently to better address the needs and interests of families. I mean, when you can go virtually to court, rather than having to show up, when you have that fear of maybe getting picked up because you had a record or something like that, the fact that people didn't understand that, and now they do understand it and are changing work, I think that's going to help us going forward as across the board. And I'll give you one example of that, and that's the child allowance that is coming out, right, as a new thing. I was on the poverty committee that under National Academy that recommended that. And as we were leaving our committee work, it was 2.5 years, we were saying, this will never happen. You know, our country just won't do it. Canada will do it, other countries will do it. And to see it now as a potential is wonderful, but it's a potential that we have to pay a lot of attention to make sure it reaches the right people in the right way. And it's intentionality around the impact of these different laws that I think we have to really be very much more conscious of.
So I'm doing a horrible job as facilitator. I had like a list of 7 questions, and I'm probably only going to make it through 3 because I want to leave time for Zandre to share with our audience some of our policy priorities. And then open up to questions. So let me do this. Zandre talked about barriers. Zandre talked about or shared with us her experience, and she's been sharing her experience nationally. And I know some of your organizations very much value having people with lived experience be part of the policy making and informing your work. So just 1 minute each. What do you want to say either about how does Congress and the administration address barriers, or how does Congress and the administration ensure that people with lived experience are at the table and part of the process in a real way? And I'm looking for volunteers.
Just do it. You know, just do it. I mean, I think that we know the wisdom and value that people bring. We have this other kind of focus on research and data, which is important. We have to have evidence-based this and evidence-based that. There should be a stronger focus on the wisdom that people with lived experience bring to the table. And all we have to do is do it. It's not rocket science to bring people to the table.
Years ago, the Congress mandated that public housing authorities have a resident on their board of commissioners. And it's that kind of unfortunately, which has to be mandated involvement though, right? I mean, if people aren't going to be able to come to that voluntarily to learn from and hear from and move on the experience of others, then I think, those, the sort of carrot and stick approach, but there's so much value and it's so important to hear from people like Zandre and others that, I really think that move by Congress to have a resident on the Board of Commissioners could be replicated in all kinds of different settings, all kinds of mission-driven organizations. So I think that's really important. And then just real quick on what Congress and the Biden administration have to do, we simply have got to increase the supply of affordable housing and housing that's affordable to the very lowest income people. And we've got to do that in a way that they can maintain stable housing, that they can do so without fear of losing their housing as their income fluctuates. And it has to be permanent housing. And this is not transitional housing. This isn't a 6 months rent voucher. There's no time limits here. We need to reinvest in affordable housing in a real U.S. housing policy way, rather than continuing to flit around the edges. And so that's what I would say. It's time for affordable housing to be an entitlement, so that huge worry, that rent eats first fear that so many millions of poor people live through every month, is no longer hanging over them.
Great, thanks, Linda. Deanna, close us out.
Yes, so Linda talked about how Congress mandated a resident be on those boards, but no one has paid attention that all industries, whether it's disabilities, mental health, have all started that practice of having individuals with lived experience. The criminal justice system is the only system that refuses to have people with lived experience at the table as they draft the policies. We don't talk about women's reproductive rights without women the last administration did, but without women's rights, women at the table. We have to have individuals, because here's the catch. Although we are at the table, we also realize we have been exploited. It's just to check the mark that the person is there. To have a person with a voice who understands policy, and not only policy, how that policy plays out in the most marginalized and oppressed communities is totally different how it's going to play out in another community. And that's very important, that our policies and changes be looked at from a racial justice lens before it's implemented, because all policies have been implemented because somebody thought it was the solution to a problem. But has it worked out very well for the most oppressed, impoverished communities to benefit? I agree with Linda. We need more affordable housing, but we need more affordable, accessible housing, because people age. They should not be displaced because it's affordable, but it's not accessible for the issues that they've come up with. We wake up every day, situations happens, and a person's whole life has changed. Possibly a stroke, falling down, breaking their legs. Do they have to be displaced because we have lack of accessible housing? So I think that's the key as we're moving forward, is we need affordable, accessible housing, because we're going to find ourselves in another pinch if we don't, as people age and things, situations change. But also making sure that we're not ostracized as a special population. We're doing this for these people, because that still disconnects us from humanity. You're doing this as a civil right. Housing is a right to a basic human need. Doesn't matter that I'm impoverished. It doesn't matter that I'm formerly incarcerated. I am a human who deserves the ability to have housing, if that is a basic need that every individual needs to balance from to thrive in this country.
That was a great way to close out this session. Thank you for that. I'm sorry that we had to kind of run through the questions, and I think we should probably schedule another 3 hours so we can spend more time having this conversation. It was wonderful. So thank you so much. And now I'm going to turn it over to Zandre, who's going to provide an overview of the principles developed by the Compact for Thriving Communities. And Zandre, we only have a couple minutes, and so I'm just going to ask you to kind of make it quick, if you don't mind.
Yes. So I'm going to start with home, because home is the most important thing to me. I can't do anything without having that confidence in a roof that's safe. So home to me is very warm, and it's secured, it's safe, and it's able for me to dream and thrive. Like, no one can ever have a thought process if they're dealing with all the survivors. But when I'm at home, I could just sit, meditate, read a book, I could watch some TV, I could look at a magazine, and I could feel totally safe in my life. And that's what I'm going through right now, and I want everyone to have that, being home and safe. And then equity, meeting people where they're at. Like, a lot of times people don't meet you where they're at because of the system saying it has to be this way. But I think there has to be an open, I think a empathy has to be in there, because not everybody's going to look the same in this situation, and not all situations are going to look the same in that situation. So I just think that, everyone should be equipped to meeting people where they are. And then the next one would be mobility, moving in between the different levels of society, like from homeless to housing. It has to be, for me, a better way for people to be able to navigate that without all the harm that comes in between it. Like, I'm looking for housing, I'm homeless, I get an outreach, and then I get into homeless, and then here comes a harm. I've already been harmed, that's why I'm homeless, So I want this to be a better transition in the mobility part. And then also the support. Oh my God, the support. I can imagine if I got supported when I was 14 years old, just say 14, but then we'll go to 18. Just say if I got support when I was 18 years old for a community that my parents was raising me in, and I had like outlets to go to and different things. Maybe I wouldn't even been in a gang. You understand? But I didn't have none of that. Like, there was nothing that says, hey, we're here to help. It's like your parents, you're on your own. I think that it's important to have community support. We vote individuals in with the hope and the prayer that they're going to support this community that we voted them into. They tell us everything they're going to do for us. They say, we're going to do this. Government says we're going to do this. Community members say we're going to do this. But once the position is there, I don't know what happens. It's like they lose sight of that agenda and it becomes a new agenda. And then we're fighting again to get that agenda back on the agenda that we just voted for. So it's all kind of catch-21. But I just want people to stand up and show out, because we have to be, as homeless individuals ascending into a home, we have to stand up and show out that we appreciate what we've been given by taking care of it, by taking care of ourselves. And so I think community leaders and government and all the ones that make the rules for all of the people like my former self, from incarceration to formerly homeless, they need to be stand up too. Stay to your word. Don't change your word, because that's what's been going on as far as I'm seeing, is that they tell me, Sandra, go, you can get a job. Here's a ticket to work.
Andre, I'm sorry. This is really
Okay.
very rude of me, and I apologize, but I do want to make sure that we leave a couple minutes for some of the questions.
Oh, yes. Okay. Okay.
So,
I know I can go on and on. So thank you for listening.
And I would love for you to be able to go on and on. So thank you for that. All right. So, Kara, do we have any questions?
Yep, we have one from Jonathan Horowitz. He asks, the COVID pandemic illustrated the shortcomings of the nation's nursing home system, but nursing home providers are a powerful political constituency in many cities and states. Is there anything to suggest that an opportunity exists now to move more aged/aging people into less institutional settings, such as permanent supportive housing?
So I'll just jump in here, Deb, if that's okay. And
Please.
Because Leading Age represents a lot of nursing homes, nonprofit nursing homes, and say that it is our members' goal never to have anyone in there who would be better served or, would rather, who doesn't need to be there, right? And so we definitely support, for example, all the home and community-based services emphasis in the President's infrastructure package. And I forget exactly what your question is, Jonathan, but I think the thrust of my response on this issue is that nursing homes will have to exist for a certain segment of the population who need that high level of intensive care. But as an affordable housing advocate, I will say that, it is our main goal that people be served in the least restrictive, least medical, least licensed way possible, so that they live in independent housing, so that they choose everything about their lives, and they can. And that's the working where there's choice. People have choice, and they're able to take action on those choices.
Thanks, Linda. Kara, do you have another one?
Yep. How can we address the needs that you've described today as we work on legislation to implement the President's American Jobs Plan?
Anyone want to take that?
So I think that, and we were just having this conversation in our organization, I think that there has to be the intentionality that we've discussed earlier as the details of the plan are worked out. Most of them being administrative details in terms of how it's actually going to operate. How is it going to accommodate the various things that we've talked about on this call? So I think that there's that intentionality. The other thing I want to say about this, as well as about housing, Deb, is that we need to be advocates for more research, because one of the reasons that some of our dreams are not promoted in Congress is that there's not enough research to demonstrate the difference that they make. So I think intentionality and research to show the difference that these different efforts will make is important to set up in the beginning before they start. Set it up now so we can see how we can prove that it made a difference.
Mm-hmm.
I'll push back on that. I am not a fan of more research around the efficacy of affordable housing, and I'm not a fan of like research around, and this is going to sound terrible, but improving health outcomes or education outcomes or income outcomes. I think shelter in and of itself is a great enough end goal, and this whole notion of a right to housing and a right to shelter. I just think that housing in and of itself is worth the investment on its face. But I agree with you that the devil is in the details, Christine, about how this American Jobs Plan works out. But the fact that there's 400 billion for HCBS, there's 213 billion for housing. These are big numbers. This is not playing around the edges of these issues. This is going big and bold and really trying to shift through resources access to services.
But the challenge is, as I sit on various committees that are making recommendations to Congress, if you can't show research, and I don't want to argue too much about it, because I believe housing is a right. If we can't show something, they don't pay enough attention. And I think the bigger the resources that are going in, the more we have to look at the details and be intentional in making sure all the administrative aspects related to those details are there. Because if people don't pay attention, we're not going to get those resources where they need to be and how they need to be to drive down the inequities that exist in all these areas.
I'll push back a little more. I'm tired of researching the research to keep researching the research. I think research kicks it down. I think the lack of basic human need. This is a civil rights issue. Research doesn't need to tell us that we need more housing. I'm with you. The shelter, the homeless count shows us. The number of 2.3 million people currently incarcerated with 99% being released back to our communities. We have the data to demonstrate the need. We just have to be bold enough to not continue the status quo in how that funds come out to the community. That's the disruption that has to happen. And I just want to bring another thing. When we research and we set all these metrics of what we're going to research, there again, nobody can evaluate my level of trauma. Nobody can evaluate the level of impact to my children because we're just researching my homelessness, right? But there are so many other elements in there. Then that's when we start to say, but now we need mental health housing. Now we need this. We just need affordable, accessible housing, and our homeless count, our shelter count, our prison count, our actual, even nursing home counts, because people are getting better in nursing homes and coming home. It actually demonstrates the need. So I don't think it's research in qualitative. I think it's quantitative. Just add the numbers up to get to see the need that's already been demonstrated.
So you all have pushed me back far enough. I think maybe I'm a little bit jaded by certain things. I've been working, for example, I'll tell you, for a long time around child rights. And there's constant pushback that children don't have the rights. Because if you give children rights, parents won't have them. So I have a hard time thinking about how we're going to make the rights argument work. But linking up with you guys, I think it will. Because the voices
That's
are
that
stronger.
cross-pollination, cross-collaboration.
Absolutely. Yep.
Well, I'm very mindful that we're past time now, and I'm keeping both our panelists and our audience on. So I just want to mention that we made available to everyone who signed up for today's session a packet of information that gives you more detail on the compact. It has the speakers' bios in it, and it also has more detail about our shared policy agenda. I want to, on behalf of today's speakers and members of the Compact for Thriving Communities, thank our audience for joining us today. You have materials, and please feel free to reach out to us. I hope you come away from this conversation understanding the import of addressing both the over-reliance and inequities inherent in institutional care in our country, as well as the opportunity to bridge systems as a way of reducing barriers, reducing costs, and reducing inadequate care so that all people have an opportunity to thrive in their community of choice. Cross-pollination and cross-collaboration should be the takeaway. Thank you.
Thank you, Deb.
Thanks, everyone. Thanks, Andre.